Okay, so imagine this. What if we could train our immune systems, like really train them to fight cancer just as powerfully as they fight off a cold? I mean, that's got to be the dream, right? And it's what's got everyone talking about this molecule called TIGIT. Actually, you know what? You guys asked us to take a deep dive into this new article from Assay Genie, and well, let me tell you, it is dense, like really dense. Charts, graphs, technical terms, the works, but that's what we're here for, right?
Absolutely, we'll break it all down. Think of it as your, like, cheat sheet to TIGIT, what it is, why everyone's so excited about it, all that good stuff.
Okay, so the article describes TIGIT as a checkpoint receptor. Now, I'm picturing like a checkpoint on a mountain road or something, but I have a feeling it's not really border guards we're talking about here.
Okay, I like that analogy. So basically, our immune systems, they're complicated, right? They have to be able to identify and eliminate threats like viruses and bacteria. But, and this is key, they also have to know when to back off, when to stand down, so they don't attack our own healthy cells, which would be bad. That's where these checkpoint receptors come in. They're like the regulators. They make sure the immune system doesn't go into overdrive.
So they're the brakes, preventing a potential immune system crash?
Yeah, exactly. And TIGIT is one of those really important brakes. It sits on the surface of certain immune cells. These are cells like T cells, which are like, the special forces of your immune system. Their job is to seek out and destroy infected or cancerous cells.
So we've got these highly trained T cells ready to fight, but then TIGIT is there to keep them under control, like hold your fire.
Wait.
So where do things go wrong then?
Well, it turns out that some cancer cells are really, really sneaky. They figured out how to use this system to their advantage to basically flip the TIGIT switch themselves.
Wait, so they're sending a fake stand-down signal to the T cells?
You got it. It's a pretty clever trick. It lets them hide in plain sight, avoiding, the whole immune system attack. But, and here's where it gets really interesting, scientists have now developed drugs that can block TIGIT. It's like cutting the brake lines.
It's like taking the parking brake off a car that's aimed right at the tumor. And from what I'm reading, it seems to be working. Like they're seeing some really positive results in those clinical trials for some pretty serious cancers too, right?
Oh, absolutely. We're talking about lung cancer, melanoma, even colorectal cancer. And get this, these TIGIT blockers, they don't just work on their own. Researchers are finding that if you combine them with other immunotherapies, the ones that target those other checkpoints we talked about, it could be even more effective.
A real 1-2 punch. Hit those tumors from multiple angles. Okay, I'll admit, I'm starting to feel like I need a medical dictionary to follow along. But it sounds like this combination therapy approach could be huge for a lot of people, right?
Totally.
Yeah.
But it gets even more interesting, believe it or not. TIGIT's not just showing promise for treating cancer.
Wait, hold on. There's more. Don't tell me. It cures the common cold, too.
Not quite. But remember how we were saying TIGIT's like a brake on the immune system? Well, what if you could use that braking power to treat diseases where the immune system is actually overactive? Like where it's attacking the body's own tissues, going a little haywire.
Wait, so instead of taking the brakes off the immune system like we do with cancer, we want to slam them on even harder for autoimmune diseases? Seriously? That's wild. It's like TIGIT is this two-way switch we can tweak depending on what's needed.
Yeah, it's pretty amazing. Researchers are always finding these new layers in the immune system.
Yeah.
And this whole thing, being able to fine-tune it, either turning it up or down, that's what makes TIGIT so groundbreaking.
Okay, so we've got cancer, where we block TIGIT, and autoimmune diseases, where we might want to boost it. But where do these autoimmune diseases actually fit in? The article mentioned a few, right?
Right. It talked about multiple sclerosis, MS, where the immune system attacks the covering of nerve fibers. It leads to problems with muscle control and coordination, and it can be really tough to live with.
Yeah, absolutely. And then there was rheumatoid arthritis, right?
A disease where the immune system targets the lining of the joints, causes a lot of pain, stiffness, and eventually it can really damage the joints. And those are just two.
You mentioned they were looking at type 1 diabetes, too.
Yes. That's where the immune system goes after the cells that make insulin in the pancreas. Researchers think TIGIT could potentially dampen that response, try to prevent more damage.
So instead of just dealing with the symptoms like we do now, TIGIT could actually tackle the root cause of these autoimmune diseases. That would be huge.
Yeah, for sure. But, and this is important, this is still a new area. The article mentioned some promising studies, even some early clinical trials. But it'll be a while before we see TIGIT-based therapies for autoimmune diseases being widely available.
Okay, so it's like we've glimpsed this new world, this potential, but we're still figuring out the map. which I guess is how these breakthroughs usually go. But you were talking about other checkpoint inhibitors before, the ones for PD-1. Those work similarly to the TIGIT blockers, right?
They're all kind of in the same world, yeah, but each one has its own rules. Think of it like this. You have a team of athletes. Those are your immune cells. Each checkpoint inhibitor is like a different coach.
Okay, so we've got our team ready to play. What kind of coaching are we talking about here?
Well, TDT, like we were saying, is the cautious coach, emphasizing restraint, making sure the team doesn't accidentally hit the wrong target. PD1 is more like benching a player, taking them out of the game completely. They can't do anything.
Okay, and then CTLA-4, that was like messing with the game plan, right?
Right. CTLA-4 disrupts the team's communication, makes it harder for them to work together, so each one regulates the immune response a little differently. That's why combining them can be so powerful. It's like having multiple coaches all working together.
All coaching staff for the immune system. But, and maybe this is a dumb question, with all this talk of boosting the immune system, are there any downsides? Like risks? No, not a dumb question at all. It's like you don't want to accidentally create a monster, right?
Right. You got to be careful. The article talks about that. Basically, when you boost the immune system that much, there's a chance it could turn on healthy cells.
Yeah.
That's where those side effects come in.
Oh, I see. So it's about finding that sweet spot, that balance between effectiveness and safety.
Yeah, that's the key.
Yeah.
And that's where biomarkers come in. The article really stresses how important those are.
Biomarkers. Okay, whenever I hear that word, I think like crime scene investigation, but I'm guessing it's not quite the same thing here, right?
Not exactly, but there is a bit of detective work involved.
Mhm.
In this case, biomarkers are more like clues, right? Clues in our cells or our blood that can tell doctors how someone might respond to a certain treatment.
So it's like a sneak peek into how your immune system works, which helps them personalize the treatment plan.
Exactly. Like, let's say your doctor's thinking about a TIGIT blocker for a cancer patient.
Mhm.
Well, identifying the right biomarkers could tell them if that specific tumor will even respond to this type of therapy. Saves everyone trouble and potential side effects.
That makes sense. Like, don't bring out the big guns unless you know they'll work, right? But actually finding those biomarkers, that seems like the challenge.
Absolutely, and that's what a lot of the research is focused on right now.
Right.
More accurate, more reliable biomarkers for these TIGIT therapies. Imagine, like, you go to the doctor, they analyze your blood, and they can tell you with confidence, okay, based on your biomarkers, this TIGIT treatment is the way to go.
Yeah, that sounds like the future right there. Personalized medicine tailored to you.
Exactly. And it's not just about figuring out who'll benefit. Biomarkers could help us monitor how the treatment's working, make adjustments along the way. So it's all about making immunotherapy more precise, more effective, and obviously safer.
Wow, this has been, I mean, every time we do one of these depth dives, I'm blown away, but this one especially. We've gone from like TIGIT 101 to cancer, autoimmune diseases, now personalized therapy with biomarkers. It's incredible.
It really shows how far science can go. I mean, TIGIT was just discovered like, what, 10 years ago?
Yeah.
And look where we are now.
Makes you think, what else is out there, right? What haven't we discovered yet? Any parting thoughts before we wrap up this TIGIT adventure?
Here's something to think about. We've talked about cancer, autoimmune diseases, but what about other areas like organ transplantation, for example?
That's right. Huge challenge there, preventing the body from rejecting the new organ.
Exactly. And right now, patients have to take all these immunosuppressants, which come with their own set of problems. What if, instead of suppressing the immune system, we could teach it to accept the new organ, just like it accepts, your own heart or your lungs?
Wow, okay, that will be groundbreaking. Is that something TIGIT could be used for?
It's definitely a possibility. I mean, we know boosting TIGIT can calm things down with autoimmune diseases. So could we use it to, like, re-educate the immune system in transplant cases, teach it to see the new organ as self, not foreign? But those are the questions, the really fascinating questions that researchers are looking into right now.
Wow, okay, that's an image, right? Re-educating the immune system. That's definitely something to ponder. Well, this has been fascinating. Thank you so much for taking this deep dive with us. It just goes to show you never know what you'll find when you start poking around the edges of science.